Hey, good afternoon. I'm here with Dr. Williams, and we're going to begin this interview just with a little overview about your job. So, could you tell us a little bit about your job responsibilities and what does your day usually consist of?
Okay, sure. So my name is Melissa Williams. I am superintendent of Macon County Schools. I've been in this position since January 3rd of 2022. And so I'm coming up on my 1 year anniversary.
Okay.
It's been a short year, but a long year, if that makes sense. But I've enjoyed it. I've been in the district for 22 years. And so I started in Macon County as a teacher in 2000. I taught third and fourth grade for 3 years. And then I became a resource specialist or like a curriculum specialist for elementary grades for a couple of years. Then I became assistant principal and then principal for 7 years. Then I moved to the central office around 2012, 2013 as the director of human resources. I did that up until about 17, 18, and then I started doing secondary curriculum and professional learning. And then I moved back to human resources. And like I said, as of January 3rd of this year, I was appointed the superintendent or elected the superintendent of Macon County Schools. And so what a typical day looks like for me, sometimes I call it a PR position because I'm answering calls. Somebody either wants to see me, talk to me, they just drop by, I have meetings. So everybody's pulling, different ways. But my primary position or my primary responsibility to me is I'm the gatekeeper of the district. Student safety is my number one goal. So I have to keep about 1,800 students safe every day. And so I lay down with that on my heart. I wake up with that on my heart because that they're considered like my children. And so the same love that I have for my son, I have to have that love or spread it because I know when parents send their students to school, they expect them to come back home. And so that's a pretty big burden to carry around. So that's my primary responsibility. And then student achievement is next because I want them to be productive citizens. And so being in a rural area where education in some sense is not, as valued. It depends on, of course, the family dynamics or background. But in some of my more rural areas, it's just not valued as much. And so the education level is not as important, I would say, maybe in some family situations. And so those students still come to school. And so I have to make learning important to them and to give them a value and a love for it.
Yes, ma'am. Wow, I can only imagine that is a lot of responsibility, and I'm sure that was, affected by the COVID pandemic. So now I'm wondering, how difficult was it for you to take over leadership of the school system in the midst of the pandemic?
It wasn't difficult at all because, of course, my predecessor had already said things. I could not imagine having to be responsible for a school district when COVID hit because it was brand new for everybody. And so the fact that it has happened now and things are already in place. And so we still have what's called either e-learning days or virtual learning. So if we end up with a wave in several of our students or schools, I get numbers and it's, oh, we have this many cases. And I haven't gotten any in a while. That's a good thing, but we're still masked. We're still fully masked too. So I think that helps mitigate a lot of the COVID and even the flu cases. And so with things already being in place, we already have, electronic devices. So we just go right back to that same platform or those platforms. But when it first happened, I was doing human resources at that time and kind of eased into secondary curriculum some too. And so we were, trying to come up with curriculum. We pretty much rolled out our educational process with our virtual school. We already have a virtual school in place. And so the platform which we use called Accelis is what we rolled out other work to with our classrooms as well as Google Classroom, where our teachers actually went onto Google in a Google Classroom platform and taught, their virtual classes. And so it wasn't as difficult because there were a lot of things already in place. But I
Yes,
definitely would
ma'am.
not have wanted to take over. And we were just actually, when my superintendent announced she was retiring, I'm like, no, you gotta wait until COVID is over. But she actually had planned to retire prior to that, but just could not leave. She said she just could not leave, us like that, and vowed that she would stay to, see us through it. And so that's basically what she did.
Yes, ma'am. And I know you said it wasn't very difficult, but even with that being said, do you think there were any challenges that you had to face, fielding staff when there were COVID cases?
There were, because we've had to, even once we came back face to face, we still had to periodically shut down school buildings. Um, where it may not have been where the whole district had to go back home, but if, one of our schools, if there was 5 or more, staff with COVID, it was difficult getting subs in. Or if a student in that class, well, you almost had to quarantine the entire class and the teacher. And so we would just shut down, oh God, I can't name the number of times I've done that, where we just sent an entire school home and said, okay, just don't come back from the break. You all stay home. If they got cases either leading into it, because you just didn't have the personnel to cover, or even with parents that are teachers, and if their child or their child's school got it, from a different district, then that parent had to quarantine, as well, which again put you at a personnel disadvantage
Yes,
for
ma'am.
staffing. Yeah.
Yes, ma'am. That is, wow, I didn't even think about, having to close down schools if, the parent or the child got in, they are different districts. And when you have to close down and those kids can't come back, how is the number of COVID related absences affected student learning?
The learning loss has been significant, even when school was closed, just the time that it was, where there was just no face to face, very little. Even though we said devices, you still dealt with, some students just not having broadband in their areas. We even went to parking like a school bus kind of close to an area. Well, if that area didn't have broadband, then it was probably likely that there was a lack of transportation in those areas too, where our students may not even have had the transportation to come to where we may have parked, that bus. And so you have those students, in those houses or those households that are just not getting any learning, or there's no learning going on. And it's already statistically, been determined that face-to-face or, a teacher visible, students being in a classroom setting, with the teacher there present, then learning just tends to, occur more often. So, yeah.
Yes, ma'am. And so now that we're still, the pandemic is definitely still, going on. But now that I guess we're trying to move a little bit past, trying to get back to this new normal, how are we, or how are you and your district trying to make up for that learning gap there?
And so we were fortunate with the ESSER funds that are, and I'll have to get you, I know I'm using acronyms and it's so many that are there. I'll have to get you the actual, meaning of those so you can write them in your report, or be able to use it. But when the ESSER funds came, we had ESSER 1, 2, and 3, where this federal money was, pushed into schools. And so that has been, oh, it's like you hit the jackpot, almost, because we're able to have additional personnel that we really should have had, in our school districts anyway, but because of our funding, and the student numbers and our average daily membership, which determines funding that we receive in this area, it just wasn't enough. We had the bare minimum. The state tells you if you have X amount of students, then you get X amount, or they're only going to pay for that amount of staff to come, or to be there occupied or employed by that school. And so if you have a school with, I'll just give you a number. If you have a school with 500 students, you may get 23, 24 teachers. Well, you end up with maybe, 20 to 25 students per class. you're not going to reach everybody, because everybody's on a different level or learning level. But because of the ESSER funds due to the pandemic, we're able to hire resource teachers. We're able to hire a lot of specialty teachers, like math specialists, all different math intervention teachers, reading intervention teachers. So we have additional personnel in the school now. The downside to that is being able to maintain all these people that we really needed anyway. Once those funds are depleted in 24, 23, 24, we'll have to start doing some cuts, and we're not able to sustain a lot of that personnel. So, it's good on one end, and then it's not on the other, unless they give us some other ways to be able to sustain that personnel.
Yes, ma'am. I see how difficult that would be. And with that in mind, these different policy changes, even just policy changes with COVID, how well have the staff, the parents, even the students adjusted to the frequent COVID policy changes?
They've adjusted pretty well. I think with the parents, I think as long as it keeps the children in school, or we keep them, we haven't gotten a lot of flash, or even from still being mask mandated, and maybe just because it's still in the city as well. But just because we have two schools on the outskirts, we have a school in Shorter, and we also have a school in Notasulga, and they're not, required to wear masks, but our schools are. So we just made it, Macon County School District policy. And so again, I think as long as we're able to keep our students safe and keep them in schools, I don't think that the parents, mind the different things that we do to mitigate, try and mitigate the spread of COVID, or flu. I would say the flu too, because it's just as prevalent now. And so as long as we keep them here, they've been pretty easy. And then we provided a lot of the materials too. And that was another thing I was going to say we were able to do with the funds that were given to us. We were able to buy, masks. We were able to buy cleaning products. We were even able to bring a cleaning service in, to help. And so a lot of things we provided for the students as well. That was allowed by those funds, the ESSER funds.
Yes, ma'am. Wow, that's great. And you've spoken about masks. So now I'm wondering about, vaccines. So when the vaccines became available for the students, how did you communicate the opportunity to their parents?
And so we have what's called a school cast. And so we put out just these blasts, messages to parents. We also use our district websites. The different schools have other platforms, Remind, and just other things they use. And so they rolled it out. And so we just got a grant with UAB, and UAB is we're partnering with the Alabama Department of Public Health. And so they're actually going to come in, and we'll be able to provide free vaccines for our students. And the students would get gift cards, different things. And so I just signed the MOU and got it board approved last week. And so I think they'll visit the first school either this week or next week. And so that will be great. So our district lead nurse, and her staff is helping to kind of roll that out.
That's awesome. And just for a little bit of clarification, is the vaccine like a mandate that they all have to have it, or no? Okay.
No, it's not a mandate. We encourage
Yes, ma'am.
students to, but no, we haven't made the vaccine a mandate. We've also provided free COVID test kits as well. We sent some home over the Thanksgiving break. And so we were able to get those test kits in as well. So we provide them for our employees as well as our students.
Wow, it definitely seems like the school district is doing everything it can to, try to go on with this new normal. And I will end with this question. How would you gauge the school system's response to COVID going forward?
Going forward, I believe
Yes.
we would just, keep the things we have in place because they've worked. We'll also just add, anything necessary that we have to. Our biggest challenge now is, getting back to where we were, or to move forward with our education, or our student achievement, and getting our students back into, the face-to-face learning, getting our students back to being to a more rigorous rigorous coursework and assignments. And so that's what we're really working towards now, or spending the majority of our time doing now. But again, as you indicated, I think we've done fairly well, with trying to educate our students, educate our parents, and just be sure that everyone is helping us in this mitigation. Even with the flu, once it kind of started hitting, I had to, go on the nurse call and said, we're getting cases, and the students were coming to school sick. And so I got on, parents, please, any symptoms, I gave the symptoms, what they were. If you see any of these, please keep the students at home because they're coming to school sick. They're not, leaving and getting homesick. They're coming to school sick. And so if you would, help us out with that. And that even helped and worked. So we'll just continue and hope that this, COVID gets on out of the way completely. I don't know that it'll ever be completely gone, but I'm glad that we tend to have, or seem to have, a grasp on it.
Yes, ma'am. It probably, like you said, will never go away, but y'all have seemed to really try to grapple with this new normal. Thank you so much, Dr. Williams.
Oh, you're welcome. It's my pleasure. I enjoy speaking with you.